Not another one. Not another one. It breaks my heart and also brings the questions in my mind about these YouTubers who decide to leave medicine. They're influencers and YouTubers who decide to leave medicine. If you haven't already known that there is a prominent YouTuber, his name is Zach, in the medical pre-med space, and he recently posted a video today announcing his departure from medicine, no longer practicing medicine.
So I left medicine at 29 years old. For context, I did 4 years of undergrad, 2 years of post-bac experience.
This has been a common occurrence in the medical space amongst influencers, YouTubers. You have Alex Jubal, you have Ali Abdal, and now Zach Highley, and there's numerous other physicians as well. The neurosurgeon who made his video recently this past summer. So many different healthcare professionals who have a platform are coming out announcing their retirement or thought process of walking away from medicine. And it's really shocking. It's very sad to me. And it brings to my mind so many questions about like, what brings a person to that point of saying, all right, all the sacrifice, all of the hard work that I put into this profession, this career path over the years, all that means nothing because my happiness now is being compromised. And it's like, for me, it's like when you're going through those roadblocks, because a lot of people's journeys to medicine is not easy, including myself. And there's plenty of moments where you're not happy. You're not happy with the outcomes of what happened along the journey. So when does that trigger in of being too much? And it seems like the breaking point for most people seems to be when they get to residency, when they actually start practicing, or that grueling training. That's when it really hits the fan. Zach discusses in his video about the endless sacrifices that he took to get to medical school, from his 2 years of post-bac to now his 1 gap year to getting into med school. He took like 3 whole years to get into med school, and then thriving while he got there, and maneuvering, doing well academically, and then trying to figure out exactly what path he wanted to go down. He decided to go internal medicine after ruling out surgery and OBGYN. And his reason was that he just didn't like the lifestyle of what they were living, clocking in super early, leaving the hospital super late, and not really having a life and not being able to balance the things. So he decided that maybe internal medicine would be best for him because of his possibility of doing a GI fellowship down the line. But ultimately, when he got to residency and started his first year, which they call his intern year, he felt like he was just a zombie. He felt like he was just going through the emotions. He didn't really feel as if he was making a larger impact in the field of medicine of what he wanted to do, I guess, originally. And part of me questions that a little bit, because everyone knows intern year is a challenging year. Everyone knows intern year, from what I've heard amongst people who've been through residency and some of my friends who've gone through residency, is that intern year is just one of those times where you're really just trying to figure things out. You're at the lowest point of the totem pole, and you're just learning how to be a doctor for the first time. So it's hard. It's a lot of adjustment. You're getting given the very difficult tasks, the mundane tasks that a lot of people don't want to do on the team, and you're really just going through the emotions. So I'm just wondering, like, did he let that get the best of him? Like, is that something he wasn't privy about? Like, is that something that he just found out about when he got there? Because it seems like that's a common storyline amongst everybody. Not saying that that is okay. Not saying that the culture of medicine and how things are is okay. There's definitely areas of improvement, room for improvement, things that need to be changed in the field. But a lot of us know that going into this path. But it just seems like all of these YouTubers, they get to these points and they just back away. They run away from it. And it's like, why is that the first option? Like, is not sticking the course and trying to internally try to fix the system, is that not the better option or better way to do it? To be the attendings or be the administration and being within the institution to make that change systemically? Is that not like an option? It just seems like they get to this point of getting into residency when things get hard. They say, oh, I'm not gonna do it no more. And I'm empathetic to the fact that it's a grueling process. Medicine is hard. It's challenging. It's so much sacrifice. I even sacrificed 4 years to get into med school. And I worked in different jobs and different things. And I ultimately said, this is what I wanted to still do. And I got here and I'm grinding it out. I'm doing well. I'm doing okay. Like, I'm doing the things that I'm supposed to do as a med student. And I'm hoping to eventually get a job one day in the future and practice and be able to call myself an MD. But am I gonna get to the same point as these other YouTubers and say, you know what, enough with this. I'm going to leave. I'm gonna go. I hope not. Like, it just seems like this is a trend. Why is this a thing now? And I've seen these videos come out before in the past and never spoke on it, but Zach kind of did it for me when he came out with his video. I never clicked on the video so fast because Zach is one of them guys. Like, he make those cool Anki videos. He's always talking about productivity, showing you how to, you know, maximize your overall well-being as a student. And to listen to him discuss how he nearly had mental breakdowns and had anxiety, panic attacks, and all types of stuff, and seeing him have a cathartic release during this reflection of explaining why he's leaving medicine, it really brings into my mind the question of, like, is this field really what it's cranked up to be? Like, everyone seems to have the same common threads woven through their stories of sacrifice, keep your head down, grind, 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 grind. Like, a lot of it is self-debilitating, and to the point where the people who are going through this training process are sacrificing so much, their health, their relationships, their sanity, to take care of someone else. But who's taking care of us? It seems like there's getting to a breaking point where some residents and some trainees are just had enough that they want to leave medicine altogether, and some people are even going as far as unaliving themselves in the process. I've been at institutions, I've heard about institutions where residents are committing suicide because of the grueling process in the training, and that is not okay. That is not okay. There needs to be change. There needs to be things done within these institutions to make it better. And I don't know who is going to be the person to be able to come in and make those changes that are necessary and needed in order to make the system better, make it more healthy, make it more accepting of folks who want to learn, who want to contribute, and ultimately make society better and impact patients on a positive level. But if they have to sacrifice their own sanity, their own well-being, their own life to do so, questions need to be raised. Things need to be changed. The old system cannot be the new system. There has to be some solution to this issue, this problem that seems to be a revolving door. It really hurts my heart to see Zach step away from medicine. It seems like this was something that he really wanted to get off his chest for a very long time. And for him to release this video as I'm a second-year med student and just listen to his story and his journey and things he had to go through, it's definitely some things that I'm going to consider and keep in the back of my mind as I maneuver through my journey to ensure that I don't become a zombie as well. That's what he was afraid he was becoming, and going through the motions and seeing other residents and other fellows in the hospital that he was working at be zombies, being lifeless, going through the motions and just not being happy doing the role that they were called to do. And that is a problem. That is something that when you are not fulfilled, you do not have purpose, you do not have passion, and you do not enjoy waking up, going to your job and doing the little things that will ultimately be a part of your role and your responsibilities, that is not one life to live. We only have one life to live. We all have a D-O, death date. We all have a day that we're all gonna pass away. And to be sacrificing and doing all these things and then not be fulfilled at the end of the road, that is a hard thing to swallow. Because then now you're questioning everything that you did to get to that point. And that is definitely living a life of regret is not cool. It's not okay. And to hear that he said in his video that he felt like he was operating like he was on 15% battery savings mode. You know, when you put your phone on battery savings mode to conserve the energy, he felt like he was operating on 15% of that while he was going through the motions of residency and going through his intern year. That's not okay. You don't feel happy to go to work. You don't feel like you're making a difference. You feel like your decisions, your contribution to the team doesn't matter. I remember before I came to med school, I was working a gap year job as a researcher and in a specific type of lab, and I was not completely fulfilled doing that role, and I wasn't happy going into work every day. And I was just saying, Lord, just get me into med school because I can't do this. I can't keep going to this job and being miserable and not being happy going to this place. And I just can't imagine feeling like that again down this road. I don't want that to happen again. That's why I'm taking my time to ensure that I'm enjoying this process, enjoying the small memories that I'm building with the folks along the way, not putting myself in the silo, and also giving myself the opportunity to explore different specialties because I have a multitude of interests and I want to be able to know for sure, like if I choose this specialty or that specialty, that these are going to be the right fit for me. Because I cannot wake up and be miserable going to a job for the rest of my life for the next 20 to 30 years or so and not being happy and fulfilled. And it seemed like Zach had that same kind of thought process, I guess, with stepping away from medicine. He said he felt drained, he felt unhappy. And he found people along his journey who he did see that they had that passion, they had that spark that he desired, that he wanted. He wanted to be happy like that cardiac surgeon that he was shadowing that could speak passionately about the road. And he said, the cardiac surgeon said that if you don't feel like the juice is worth squeezing, you have to ask yourself, do you feel like the juice is worth squeezing? And if the juice is not worth the squeeze, then you might have to think something else. You might have to figure something else out. So there's people that realize that the juice is worth the squeeze. Right now, I believe the juice is worth the squeeze, but hey, that could change at any minute, right? But he made that decision based off of the feelings that he had during intern year, not being fulfilled, seeing other people go through the motions, being zombies, and feeling like their brilliance were destroyed, feeling like those fellows and residents that were in his program weren't as happy, they weren't as fulfilled as they once were when they first got their long white coat. And everybody wants that long white coat. Everybody wants that big MD on their ID badge, letting everybody know that they're the doctor, that they're the one that's coming to save them and help them, right? You sacrifice so much to get there to that point, but then ultimately you might have to say, I don't know if this was the right decision. Is the impact that I'm making worth the difference of the sacrifices that I put in?
Okay.
That's a hard question to ask. Man, it was just hard for me to sit back and watch Zach talk about his departure. It really felt like a cathartic experience of him just letting out his emotions and really just having a release, being able to release that frustration that he's had for these past couple, I guess maybe months or years building up to this point. I'm disappointed in him leaving, but I know he's not going to be leaving us on YouTube. I know he's not going to walk away from what he's built so far on his YouTube channel. I've been inspired by his videos and his content over the years. I'm sure he's going to continue to find ways to positively impact all of us that have tuned into his journey over the years. I'm looking forward to the different endeavors that he's going to pursue and continue to build upon after making this big decision. Man, it's definitely hard to see, but you know, life will move on, and he's definitely going to continue to do great things. I'm looking forward to his future success and continue to follow these different YouTube influencers in the medical space and seeing what they do. Alex Duval is continuing to build up med school insiders. Ali Abdallah has his businesses that he's working on and is staying consistent on YouTube. And now we're gonna see what Zach does. It's definitely one of those things. It's like, what's going on? Like, this is definitely shaking things up a little bit. And a lot of us are just sitting back watching, and now we're questioning our decisions. But hey, we just gotta continue to keep pushing along our journeys until we hit a roadblock and see if we can maneuver through that roadblock and push through and make the decision on our own that's best for us. I just wanted to make a reaction video on my response and just seeing, you know, Highley come out with his announcement of his departure. I just wanted to share my thoughts on it. I know it really doesn't mean nothing in the grand scheme of things, but I'm just tired of sitting back and being quiet and watching all of this unfold on YouTube over the past couple of years of all these major players in the medical space on YouTube walk away, step away. Hope you all enjoyed this video. Please like, subscribe, hit the notification bell. And remember, it's not a marathon nor a sprint. It's a mission to medicine. Peace.